In Saskatchewan and Alberta at the beginning of the 20th century, healing meant the traditional medicines and practices of the First Nations. White settlement brought with it two new role models for nursing. One was the nun. As early as the 1860s, Grey nuns walked the long, hard trail from the east. They founded many of the province's hospitals. The nuns treated everyone: settlers having their first babies, railway workers struck by typhoid, cowboys thrown from their horses, and First Nations families decimated by smallpox. Florence Nightingale created the other model for nurses. Nightingale's experience was forged by the Crimean War, and the system of nursing she developed was rooted in that military model. Nurses wore uniforms and adhered to a strict code of conduct. The military-style discipline prepared nurses well to take an active role in the First Great War, but it didn't prepare them for the carnage they encountered overseas.
Being so close to the battlefront meant that nurses would tend to soldiers who had been wounded in battle. Rows upon rows of wounded soldiers would be laid out on stretchers on the cold, hard ground where the nurses would have to stoop or even get onto their knees to provide care.
At home, new laws required nurses to register. This in turn created the first professional nursing associations. Women in Saskatchewan and Alberta won the right to vote. In 1917, Alberta nurse Roberta Maxwell was elected to the provincial legislature. Despite the gains made in acknowledging the value of nurses in society, in their workplaces, they were still at the bottom of a rigid hierarchy.
The doctor was a god. You weren't given any credit for using your own intelligence, and yet you were the one that was with that patient. And you were with them 8 hours a day. We had 12-hour, 14-hour shifts. So you knew that person really in a much better way than the physician who knew them. And I got into trouble many times, which is why, I kept saying it has to change.
Changing the system, however, was not part of the training that nurses underwent. Most hospitals ran their own schools, and student nurses provided a large part of their staff.
There were 3 shifts in the day. They were 12 hours long, but were divided. The probationers went on duty at 7 in the morning and went off at 7 at night, with time for meals. At maybe 9 o'clock, you would get a study session. We didn't get days off. We got a half a day off in a week. You couldn't have Christmas or New Year's or any holiday off. Those were considered for the patients.
We were literally slave labor in a lot of cases, and we had no respect from anybody. The doctors abused us, the managers abused us.
Outside the hospitals, the system was often more flexible. If there was no doctor within 100 miles, a community was entitled to a district nurse. They provided her with a furnished and heated cottage. The provincial government paid her salary. These nurses practiced an expanded range of skills: testing children for medical problems, giving inoculations, and delivering babies. Even in large hospitals, things were changing. The exodus of nurses overseas in World War II brought on a shortage at home.
We were very short of experienced nurses. You got very quickly from being a student nurse to being a head nurse. It was nothing. It was just almost overnight. I was a very young head nurse, and you learned every day as you worked.
At the end of the war, nursing was one of the few occupations women weren't forced to abandon to make room for the returning soldiers. However, its status as women's work was reflected in poor pay and working conditions. In 1948, nurses earned $120 a month.
And they always joked and said it was just barely enough money to cover the cost of their stockings, because they had to wear, of course, they had to wear full stockings, and they wore the starched bib and aprons and the starched collar. And
doctors still ruled the roost.
We were told if a doctor came into the room, we were to stand up, give up our chair. So if you were in the nursing station charting and a doctor walked in, you'd have to stop and stand up and let him have your chair.
By the 60s, the women's movement was having an impact on how nurses looked at their job.
Part of your not being valued is because of you're a woman. And I think that was very important. In terms of nurses having the confidence to stand up, there was very much an ingraining of servitude and silence. And, you know, you didn't taint stuff with talk about money.
And when nurses started to talk about money, they couldn't help but see how far behind they were. In the 70s, clerks at Safeway stores made more than nurses.
I'm making $7.96 an hour, which doesn't sound bad for a, quote, woman's wage, but I've been graduated for 15 years from a skilled training program of a 3 years program, and I see no reason why I should be only making $7.96 an hour.
When I graduated, it was common to work 13 days in a row, all 3 shifts over those 13 days.
To change the situation, nurses formed staff nurses associations. But these SNAs did not have the full status of a union. In Saskatchewan, the issue came to a head in 1973. First the Labour Relations Board, and ultimately the Supreme Court of Canada, ruled that the SNA could not be certified as a union. Nurses, already in the midst of contract negotiations, appointed a steering committee to examine alternatives. In 1974, nurses representing 43 SNAs met to discuss that committee's report. The Assembly unanimously approved a motion to form a provincial union.
Everything was going along fine until they decided to pick a name. And they picked some name they really liked, but it abbreviated into SIN. And no way, so it took us another 2 hours, and somebody came up after lunch break with the word Saskatchewan Union of Nurses and abbreviated into SUN.
Mary Parchewski became the first president. Within a short time, the new union was forced out on strike. After 24 hours on the picket line, they reached a settlement which raised wages by 34%. Events in Alberta followed the same pattern. The United Nurses of Alberta was formed in 1977. The newly created UNA inherited a set of contract negotiations which looked like they were headed for a strike.
Strikes for nurses were perfectly legal in those days. The strike at the Holy Cross and the Calgary General, 5 other major hospitals across the province, began at 7:30 on July the 4th, 1977. The front doors of the hospital opened, and this flood of white came down the steps, across the parking lot, onto the sidewalk where we passed out the picket signs.
The government ordered the nurses back to work, and they went. But it was clear to everyone, nurses were ready to stand up for themselves. In 1983, the Alberta government passed legislation making strikes by nurses illegal. As negotiations grew tense in 1988, the Labour Relations Board ruled that even holding a strike vote was against the law.
You know, if there's one thing that a group of women hold dearly, it's the franchise, right? You can't really say to women, you can't vote. They thought that battle was won some considerable time ago.
Across the province, nurses went on an illegal strike for 19 of the coldest days in January.
And then the government started. They started with threatening fines, and we went, oh, yon, fines be damned.
The total fines against UNA and its members amounted to nearly $450,000, the largest ever levied against a union in Canada.
The 8/8 strike was about not going backwards, and we did not go backwards.
Within a few months, Saskatchewan nurses were also on the picket line.
It's really frustrating for us, and we don't like being out here. But there are days we come off and we're so exhausted, we have no time for our families, we have no time for anybody, and our patients suffer a lot because we're so tired if we're not staffed adequately and we're putting patients at risk. The public has to know that because that's who we're serving. It's the public. And there's no way that they can silence us.
The solidarity paid off in a positive settlement. The 90s brought a series of devastating cutbacks and hospital closures.
The early 90s were terrible. They were terrible. We were closing units at our hospital. They were laying off nurses. We had weeks and weeks and weeks and weeks of bumping.
It was just too much. Going off duty every night and not feeling you've done everything. And I think that was very destructive for nursing.
And we lost a whole generation of nurses. We had lost a whole generation that went to the United States, that went other places.
Una and son fought back with rallies. The shoe-in on the steps of the Regina legislature was a visible symbol of the nurses who had left the province.
I think that the restructuring that had happened in healthcare, where nurses saw their workplaces decimated, many rural places closed, the workload was increased substantially in every sector of healthcare.
At the same time in Alberta, Una was leading the fight against government attempts to introduce private health care.
I mean, they privatized laundry, and then housekeeping was privatized, and now they privatized part of the food services, and now almost all the food services are privatized.
This culminated when the government introduced Bill 11, an act designed to pave the way for private hospitals.
Grew massively, exponentially every night until there was thousands of people.
As Alberta and Saskatchewan enter their second century, nurses are well aware of the challenges that face them. However, they can also reflect on the gains they've made.
I have seen over the years, over 40 years of nursing, how things have progressed for nurses.
The nurses who fought these battles, who formed this union, these are the nurses who were paid less than the Safeway cashiers were being paid in 1977. The nurses who have defied the law, the nurses who have walked the picket lines in 40 below weather, the nurses who have gone through this battle and created this union and put together a collective agreement that give nurses $37, $38 an hour.
What would I want it to be in 25 years? The support to criticize and advocate in the way that is absolutely imperative nurses do, to not only protect themselves, but certainly to protect their patients.
We've tended to think that nurses are just for the sick. They're not. It's a helping relationship, that you care if someone has a problem.
I felt that the ones that cared for the patients made the difference, and that's what it was. You cared about the people you were looking after.